Well, we've all signed those so-called HIPAA forms at the doctor's office, giving permission to release your health information or not.
But in the mental health arena, these papers might as well be a brick wall for some families. First News This Morning anchor Amy Radinovic looks at the dilemma and why some are calling for change.
Do you care if someone knows you're a diabetic or have cancer or HIV? The HIPAA laws were made to give you the right to protect your medical information, but sometimes secrets and mental health don't mix.
So many times you feel like your hands are tied.
Linda Eels of Lisbon is the president of Columbiana County's NAMI chapter, the national group that's organized to help families battling mental illness. Linda says many parents of mentally ill adults struggle to get information or face doctors who won't listen.
Parents will say, well, I just want to be able to see the doctor and tell the doctor what I know. I live with this every day. I need to tell somebody what I see, what the behaviors are, what they're doing, what they're not doing, how they won't take a bath, how they won't get out of bed.
That is what happens, but that's a misunderstanding of HIPAA laws.
Pennsylvania Congressman Tim Murphy says nowhere does HIPAA prevent doctors from listening. And with mental illness like bipolar or schizophrenia, lack of information can drive the problem deeper into the shadows.
You had that young man at Virginia Tech who was showing signs of severe mental illness. They didn't call his mother. His mother didn't even know he had problems. And then he goes and he murders several people.
We've seen it again and again. Newtown and some 20 elementary students massacred. A deadly ambush at a Colorado movie theater where the shooter's parents insist he's no monster, just seriously mentally ill. Congressman Murphy, the only psychologist on Capitol Hill, believes some of these tragedies could be prevented. I talked to him in his Pittsburgh office about his new family mental health bill. It includes a slightly looser hold on HIPAA where relatives are concerned.
They would be allowed to reveal information that would be limited to things like the next appointment, who's a treating doctor, location of that appointment, medication. They don't have to know everything else, but just enough so that family member can facilitate that person getting on with their treatment.
But even this slight change makes the director of the mental health clinic in Lisbon uneasy.
Some clients really don't even want it known by anyone else that they're coming to have appointments and being seen. People come to us to share very, very personal information, and if we didn't protect that, people wouldn't come and talk to us.
And while the clinical director says they encourage family members to be involved in treatment, when someone refuses to sign the releases, counselors must monitor.
We try not to impose our will on folks unless there's a very imminent risk of danger to self or others, at which point we try to involve medical staff, law enforcement, whatever it takes in order to ensure the person's safety and the safety of those around them.
As HIPAA stands now, the best advice for family members is to keep a written history of symptoms, medications, any past therapists and their phone numbers. And if you run into a problem with a doctor or even in an emergency room, you can hand over all that background information that you think might help. Dave, Erica?
All right, thanks, Amy.